Welcome back to Strength Happens. Today, we're continuing our advocacy mini series, and we're talking about something that's deeply connected to self advocacy storytelling.
Yay! I love storytelling because so many
Yes.
family yes, I do.
Yes, you do.
I have a problem with storytelling. Um, because so many families are truly impacted by chronic illness or disabilities with their children or their loved ones, and your story is truly told about you long before it's told by you. And I think that's the importance of storytelling. It's your words, it's your story.
That's a powerful statement. And I think doctors just summarize 25 years of medical history down to a couple paragraphs. Schools reduce it to a file,
Mhm.
and it's basically just checking boxes. Do
Yeah,
they qualify for this? Do they qualify for that? And
mhm.
that's the end of it.
Absolutely, and somewhere along that way, the person who is living the story or the family who is holding on to that story, they can get lost in the process.
Yeah. So today we want to make sure we talk about how storytelling itself becomes a form of self advocacy.
And not just inspirational storytelling, and not storytelling for the sake of just talking, but, I like that storytelling too. Uh, but today we're gonna talk about that honest, raw, real storytelling to be your own advocate, the storytelling that is your own advocacy or advocacy for your family.
Well, let's start here. Why does storytelling matter so much when we talk about advocacy?
Yes, well, as I said, I am a storyteller, and storytelling truly matters in advocacy because storytelling is often the first place advocacy actually shows up. Even before we're
Hmm.
asking for accommodations or setting boundaries, even before we receive a diagnosis for our child, we are telling a story about what's going on. We're describing their symptoms. We're telling about what it's like when they're sleeping, when they're awake. We're telling that story each time we're seeing a doctor or talking to a professional. So that's the first form of advocacy that I had with my family, and I think it's true for many families.
Yeah, I feel like that's a new way to interpret it because everyone is telling our story. You're basically gathering up some facts and then you're putting in your take on it or your emotion behind it. And you're able to share what you've gone through. So it's basically storytelling. But
Absolutely. I think stories humanize people's needs. And in the medical system, that really sometimes prioritizes efficiency. They only have 15 minutes or 30 minutes, whatever their window is for that
right.
doctor. But telling these stories really humanize that individual's needs, that child's needs. Stories help people understand the impact behind a medical condition, impacts the person, how it goes beyond the label of a diagnosis. And for the person telling the story, it offers meaning behind their lived experience. And over time, it can really build self worth and confidence in what their value or their place is in the world. And as part of our foundation, the Holly Grace Foundation, that is a lot of the work we do is through narrative storytelling of sharing our stories, but allowing other people that space.
And when people don't control their own story,
That's a tough one. Then advocacy becomes harder, I think, when they're not telling their own story. You're
yeah.
constantly reacting instead of being proactive. You're correcting other people. So, we're going to talk about today a little bit about how we can make it more proactive as opposed to reactive.
So pretty much advocacy isn't just asking for accommodations or medications or treatment options in this case.
Exactly. It's claiming the authorship of your own experience. And we have a right as parents, and our kids have a right as individuals to have their voice be part of the treatment.
Well, I think a lot of listeners will relate to this and what happens when stories are taken or rewritten by systems instead of through their own voice.
Absolutely, 100%. I can't tell you how many times I've read those appointment notes or hospital summaries for one of my kids and found incorrect information or even wrong diagnoses listed. And it's important that we are able to adjust that narrative to make sure it's the correct narrative for our families.
Yeah. Recently, we brought Morgan back to the allergist, And when going through her chart and verifying, how they'll just run down, oh, does she still have the XYZ? And they listed hemolytic autoimmune anemia. And I was like, what is that? Because it wasn't anything I was familiar with. And basically, they were like, yeah, she tested positive for that when she was like 4. So I'm like, that's 20 years of not knowing that that was even on there. And is it valid? Did she outgrow it? Does she have it? So then basically, it sent us to another specialist, so it just validates that keeping records straight is very important part of advocacy. It really matters.
It matters a lot because those words on the paper follow your child into the next appointment, the
Mhm.
next provider, the next decision.
Yeah, there are many times I have found just going through that there's things listed. I'm like, she doesn't have that.
It's almost like how much do you take the time to let that doctor who you may not see again get corrected, but then it's on their file and it follows
Yeah,
them. Yeah,
that's the one good thing about now that we're at a university is everything's tied in together through my chart. So every doctor and provider we see goes through my chart. So I really should go through that and clean it up, making sure everything is 100% accurate.
yeah. Oh, I was like, "You said 100%, but you didn't say that."
Did. But and schools can be similar too. I mean,
Absolutely. We were fortunate to live in a good school district and had some amazing teachers and speech pathologists and OTs and PTs, but it wasn't always that way. In the early years, we had an elementary school principal who told us no kindergartner in our school will ever get a computer, despite Hallie's hands being disabled and she couldn't hold a pen.
yeah, it's ridiculous that they feel that they can make that decision when they don't have the authority to make that decision.
It's one of the first times I really remember having to advocate for Hallie, and I've talked a little bit about that in previous episodes, but when I explained that Hallie had rights and assistive technology was required by law, she still refused, and we still had to fight for that. And I feel like sometimes leaders or not as positive leaders will say, exert their power based solely on what they read on a piece of paper, not who your child actually is. Like she read chromosome deletion and instinctively said, this child doesn't have anything to contribute. And I'm
Right.
like, Hallie had 125 IQ and she had so much to contribute to the world. And she should be able to hold a crayon, but can't, and so she's given a computer. That's
Yeah.
why helping kids and families learn to share who they are, not just what's written in their cume folder or what's written in their My Chart is so critical at this point.
Well, and sometimes storytelling is about safety also.
Absolutely. I'm sure you guys have experienced it. Neely's peanut allergy is a great example of that. Hers was a huge safety issue, and we taught her to use her own EpiPen in kindergarten, and teachers had to know how to use it. And from kindergarten through grad school, where she is now, on the first day of every class, she has to get up and share her story about it being someone with a peanut allergy and what that means. And she doesn't like it, but she does it just to stay safe. And
Yeah.
that story is one way we taught her to advocate for herself at a young age. In kindergarten, we coulda got up and said, or had the teacher get up and say, "Hey,
Right.
Neely has a peanut allergy. You gotta make sure you wash your hands." But Neely's like, "I wanna do it," and we helped her come up with like, a little script to say, and then she got all hammy about it and engaging, Neely. But every year she's done that again and again, and it allowed her that form of advocacy for her own personal safety.
Well, I think too, as kids are taught to read and they're taught through storytelling. So I feel like it's a really easy way for them to grasp that advocacy at such a young age.
Absolutely, and when we tell stories, it becomes part of our history, right? That's how before written language was done, they passed stories down by telling the story over and
Right.
over again. And when our kids are little, they hear us say that story over and over and over to the doctor. It eventually becomes ingrained in their story of themselves as well.
What do you think about the fear of being labeled difficult or emotional when it comes to storytelling? I know we both have experienced this in our medical journeys with the girls in both medical and school environments.
I think this is especially true for women and girls. Disabilities, at least in women, can be viewed as, oh, it's anxiety or, oh, it's associated with your period. But
Mhm.
disabilities are emotional. And that's normal to be emotional when you have a chronic illness. It's a normal
Yeah.
to be exhausted and fatigued and cry about it and be anxious about it. That's normal. And we need to normalize the abnormal because this is our lives. These are our kids' lives. And there's nothing that we should be apologizing for.
I do see, though, it gets to be exhausting. It's exhausting to constantly have to tell and retell these stories over and over, but I think it's a better option than not, or just trying to rely on a chart.
Yeah. I mean, I think it's critical, and I think it's just something that we have to expect when it comes to the medical community that every doctor wants to hear it in our words. A lot of them will read the chart, but I respect the ones who wanna hear it repeated because they
Mhm.
wanna get a firsthand knowledge. And I think it can be at times traumatizing to young people when they're hearing that story over and over, or if they're having to repeat it. And
Right,
that's something that I think we as parents have to be mindful of as we teach our children and then young adults how to share their story. We want to guide them on what to share and with whom. You don't have to share your full depth of all your diagnosis with
right.
everybody you come in contact with. 'Cause we know as our young people are in college, not everybody's ready to hear that, and it can be re-traumatizing to them just to share the story, but it can also be overwhelming to them to know, "How much do I share?" Especially if our young girls start dating someone, "How much do I share? When do I share it?
Right.
Is this someone I trust enough to share?" So, whether you wanna share it with someone or you don't, both are valid, and it's one of the added responsibilities to parenting of helping our kids find that path of having to share something new about themselves.
How would you guide that as a parent?
I think teaching with purpose, is there a reason to share your medical background? With Neely and her airborne allergy, it was a safety issue, so we taught her when and how to speak up, and we supported her early on, and over time, she slowly took the lead with teachers and coaches and now coworkers and students she teaches. When kids understand why they're sharing about their medical issue, that's where advocacy kind of overlays. And their self advocacy builds confidence and self worth. So it's something we should celebrate when they're advocating for themselves. Can you think of another reason someone might want to teach advocacy or around?
I think another big reason is just understanding, because advocacy around diagnosis isn't only about preventing an emergency from happening, it's about helping the teachers, providers, and peers to understand how someone experiences the world so their behavior isn't misread or their needs aren't ignored. Whereas with Morgan, she doesn't speak for herself all the time. So you can't just assume she can't do something or that something's wrong because she doesn't say that there's something or not wrong.
100%, 100%. We did this thing with Hallie, and when she was little, we wrote a little letter about tips for teaching Hallie.
Hmm.
She gets distracted or easily, so don't put her chair by the door or window.
Right.
If you need her to remember something, put your hand on her shoulder. That input triggers her brain to stay focused. And we'd always ask Hallie's permission. I'd read it to her, she'd read it. I'm like, "Are you okay me sharing this with your teacher?" And she'd say yes, and she'd deliver it to the teacher. But right before she went into middle school, she started writing that letter, and she'd type it up on the computer, and it was a little different than mine, but it would be like, "My name is Hallie. I'm 12 years old. I have a diagnosis of blah, 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 but I love to read books, and I love dance, and I'm an average teenager. Just so you know," and then told her side of it, which was powerful for me to see that transition. But I think as we lead by example and share our children's story with our teachers or doctors, slowly they learn what that story is for themselves, and then it's powerful to watch them, and it's prideful to be like, "Wow, my kid's facing so much, and look what she's doing for herself."
Well, it brings that human element also into it. Instead of it just being a diagnosis on a piece of paper, it's bringing her to life for them.
Yes, and it's humanizing it, right?
Uh-huh.
It's put and we would always put a picture of her so they'd see, and we'd email it ahead of time because, I think they will read the IEP, and all of a sudden it's like, "Oh my gosh, it's gonna be overwhelming," "What's gonna happen?" And they're like, "Oh, she's a kid just
It's
like
not
the
that
others."
bad.
No.
Yeah, this is totally manageable. 'Cause I remember teaching, you'd get a file and some of the times the descriptions or the behaviors, and you'd be like, oh my gosh, this is going to be a year. But then when you get to know them, not showing those behaviors with you, it may was just either a growth time that they were just a little bit more immature and they've grown, or your personality fits their personality better. There's so many different components.
Absolutely, absolutely, and I think just allowing them to use their voice and helping our
Hmm.
kids find the right time and place to use their voice in the school system, with their medical providers, on different areas like that, I think it's so important, and
Yeah.
I think it's important for us too to use our voice and be their advocate.
And I think the biggest thing is they can find their voice, but it doesn't mean they have to share everything. It's ultimately their choice, and they're going to create the boundaries and maybe even the timing. They might not want to share everything right from the get go, especially when it comes to friendships or, like you said, building a relationship.
Absolutely. And I think you said this earlier, it's about finding those boundaries. It's giving yourself consent of your own story, and you don't owe anybody else anything.
Perfectly said. So, how do you teach self advocacy, especially to kids and families?
I think it starts with ownership. This is your story, telling our kids that you don't owe it to anyone. You're allowed to change how you tell it. And that might look like letting your kids correct adults when they get something wrong, or even
Mm,
correct the doctor. Or it might allow your child to say, I don't want to talk about that right now. And there have been times when my kids are like, I cannot sit through you telling another specialist everything. Do you mind stepping out in the hall when you talk to them? So the doctor
okay.
will come in and ask their case history, and I'll say, can we step out in the hall? Or, go to your office. Advocacy and storytelling, when we're helping our children learn, takes practice. They're not going to always feel super confident, but giving them those little nuggets to practice. And we mentioned before, advocacy is a skill that we can learn, and it may take time. I know one skill way we have taught our kids is when they go to the doctor's office, the doctor's like, "Why are you in today?" I'd always look to them and say, "Would you like to share with Dr. Tappan?" And I always gave them the option to talk first. Many times they didn't want to, but slowly they did have that opportunity to take the ownership of their own medical diagnoses.
Very good tips. And storytelling doesn't always mean words because different ages and abilities use different tools. It could be drawing or AAC device, like an augmentative and alternative communication system. Even third person language, like my body doesn't feel like that. Story doesn't have to be verbal to be valid. Uh, Do you think it's valuable to have scripts available ahead of time?
Scripts can be powerful. I've taught my own kids this often, and with young people I work with, my students will come in and they'll have to go speak with a professor. So I'll help them develop a quick way to say, I have a medical diagnosis. When I have a flare up, ABC may happen. Or if Hallie was slower to process, so I always taught her, can I think about that and get back to you? And I think with Neely, she had one when she was younger. She couldn't drink alcohol because of a medication she was on, but she didn't want to go to parties in college, explain to people. And she'd be like, I don't drink. I save my calories for cupcakes. So she used humor and had a prepared little quip that she could say. So I do think scripts reduce the pressure on our kids, and it really preserves some of their energy and creates a safe environment for them to share.
Yeah.
And I was just thinking too, you were just talking about how we have other ways of storytelling. When you were saying Morgan doesn't always share how she feels, but I know just today you mentioned she's having an issue with her stomach and you said her stomach feels itchy. And she's communicating in her words,
Right.
but your advocacy as a mom has to translate that. So whether it's researching when kids say this, what else could it mean, and
Hmm.
brainstorming ideas with your doctor. But sometimes when our kids have different ways of communicating, or unable to communicate fully, it goes back to you to being the advocate for them. And I thought that was really powerful today when she said that because she was advocating for herself.
And then I become a detective.
Yes, that's exactly what you're an advocate detective or
Yeah.
detective advocate. It's so hard. What does that feel like having to do that?
At first, I hate to say that we kind of dismissed it like it's just a skin. Maybe we've gone through it's the waistband of her pants, the underwear that she's wearing. We've tried three or four different pairs of underwear. We've tried to change the detergent in the laundry. So it's all of these things you're constantly trying to scan in your brain what in the world could be causing her to constantly be scratching at her stomach area. And then now because we've been dealing with all like the vomiting and not tolerating her feeds as well. I'm like, is it the formula? Is it something that's causing irritation on the inside of her stomach. So then I'm Googling, can formula cause, an allergic
Itching.
reaction on the inside versus externally. And typically
Oh.
it's not itchy, it's discomfort or it's inflammation, possibly.
But that's a word she knows is itching, right? Because she also has a feeding tube that gets granulation tissue, and that will get itchy. So if that's what she holds that sensation to that
Right.
word,
She's trying
that
to explain what the sensation is. And we've done the cortisol cream on the outside. So now I wonder if I use allergy medicine in the morning, the citrazine on top of the Zyrtec at night. I wonder if that will help at all. So trying that one out right now. So,
caregivers
so
are true advocates.
often doing one thing over and over again. And I imagine when I have her GI visit Friday, we'll be telling a story because I
Yes,
have lots of them from the last time that I met with them. And we're telling the story of our child when they can't explain it themselves because she can't, only words she has right now is the scratch, the itchy.
the itchy.
So I'm basically left up to explaining her body, her needs, the limits, and overall what basically helps her feel safe. So, so
So hard.
it is, and it's overwhelming a lot. But we'll talk about that in our next episode
Yes,
because I am
yes.
like the queen of that now. But it's
You've been through a lot this past year.
yeah, it's been a long process, and it's hard too when it's an internal thing I can't see, and if she's not keeping things down. So it's just that part's stressful.
And it's not just the medical community. Do you see it when you're having to advocate for her in schools or her care center?
Well, when she was in a school, more so in the school setting, now that she's in an adult day training center, we just keep her home for however long we need to keep her home. So it's not the same. But when she was younger at school, if she misses too much, they're on your case about them missing school too much. And they need to understand that it's not a choice. We're not choosing just to keep her home and that we need to make these decisions for her safety. And she doesn't get other kids sick. And she
Exactly.
has a low immune system. She's going to get sicker than more people than other people. Um, so it's making decisions no one prepares you for, and you're stepping into a role I never expected, but carrying the responsibility because leaving the story untold would leave her unprotected.
Absolutely. And that's
So
your
sometimes
job.
advocacy is knowing when to step back and let your loved one tell their story in whenever they can, while staying close enough to help if they need it.
Absolutely. What does it feel like for caregivers when you tell a story?
I think it's harder as an adult because I feel like every specialist we see is all separated, even though we're at a university setting where everything's linked and they can see her full history, but no one has time to sit, see her whole history every single time we go in. And you just have to do your best to make sure that everyone has the information that they need and you make sure that they see her and that they're taking care of what her needs are today. What needs, like, she can't be put under unless it's cleared with her kidney doctor. So you need all those clearances. And it's the same way with a medication we're trying to start. They need that clearance through the kidney specialist, but yet they can't seem to contact the kidney specialist to get that approval. They should be doing that. They're all in the same building. Why
You
can't
would
they
think.
do that?
Well, and it's when you put it that way, it is such a heavy role for the caregiver when we are talking about advocacy because it requires constant translation. You're trying to figure out what Morgan's communicating with her medical issues and losing weight and vomiting, and then you're trying to translate that to the doctors and get the doctors to communicate with each other. And with that comes, I would assume, some fear, or at least I've known with my family situation, the fear of getting it wrong, that I'm not sharing enough of what needs to be said. And
Yeah.
it's that balance of speaking with our child, not over our child, leaving room for that story to evolve, shifting the narrative to support over time. But really, with each kid, it's different story. As you're
Yeah.
saying with Morgan, you have more advocating that you have to do as a caregiver because of her other disabilities and inability to fully communicate. Have you
Right.
had a different pathway? I said, "Is it about control?" And you're like, "No, it's not about control, but I do have to take the lead." With your other girls, is letting go of that control hard, or has it been hard?
At times when I first started the transition with them, we would have conversations prior to going to the doctors, and I really tried to sit back and let them speak. But I also will say that their pediatrician was a pretty hardcore on that. She would
Oh,
very
of
much
them for
directly
advocacy.
speak to them as soon as I think it's 13 is that cutoff age. She really would speak directly to them, and then I wouldn't say anything until I let them kind of explain, and then if they were missing something or not explaining in the right terms, then I would interject as needed. Matthew's been a lot easier just to send on his way, and he's like, "I got this." "Oh, okay." Where the twins still like my guidance or rely on me more so. Katie's doing better because she's away from the home, whereas
So
Shannon, because
she's
she's still
forced to kinda
home,
do it all on her own.
yeah. But they're 21, they should be able to, you know.
You know, Neely's 22, but if she has to send an email to somebody or put something in the portal, she'll send me a screenshot. "How does this sound? Did I touch on everything I shared with you earlier?" And I'm like, "Hey, you got everything." So it's that allowing them that have that power, that responsibility of being their own storyteller.
Mhm.
But I love when they still wanna check in with us to make sure they're on the right track. But
Yeah,
if they don't, that's their story too, and they learn the bumps along the way.
yeah. They learn pretty fast, yeah, especially if something doesn't go quite the way they thought, they'll learn.
Yeah, very fast.
Mhm. Yeah.
And then we hear about it as well, at least some of my kids. Janine, you said your girls are 21, Matthew's a little older than that. But with Morgan as her primary caregiver, and she does have some intellectual diagnoses, um, what did that look like when she turned 18 for advocating for her?
Well, as she got older and when she hit 18, the legal system expects independence. From an 18-year
Right.
old, you're immediately taught that, okay, now you make your decisions. Well, that wasn't what we could do for Morgan because the decision making is a lot heavier as she was aging. We had safety considerations and the legal expectations didn't match reality of what was going to happen. So we decided to become Morgan's legal guardians, and it wasn't to take away her autonomy, but it was to preserve it. And I had a hard
Well,
time with that initially.
that's a great way to say it, though. Could you kind of tell me what that means to you?
Well, initially, when you're told that now I have to go to court, pay to take away her rights, when her whole entire life we were teaching her to be her own person and to help make her own decisions, and then all of a sudden, you're told that no, that can't happen anymore. So I just feel like
It was a
it,
double-edged sword
it's
almost.
weird. Yeah, you kind of have to reframe it, and that's where we came up with, we're not taking away the autonomy, we're just trying to preserve it. So for us, it wasn't about the control, it was just about the continuity of keeping her care
Oh, I like
in
that.
place. Because
Mhm.
she does have a lot of medical conditions. If she didn't have the medical conditions, maybe we could have done more of a partial guardianship. But because she has the cognitive issues as well as the medical complexities, we really needed to be full guardians. And so it allowed us to continue advocating in medical spaces, critical decisions, and ensure Morgan's needs weren't minimized or misunderstood simply because she reached a certain age. So being her advocate means knowing her. We know her baseline when she's feeling good. We know her
You knew
stress.
her better than anyone.
Right, when her comfort, I watch how she walks, and then I can kinda determine, "Oh, her hip seems to be bothering her today," and I might ask her, "How are you feeling?" And then she'll either say something's hurting or not, but just her overall demeanor. You just to watch everything, and that to me tells how she feels better than any doctor's medical chart or school file would say.
It's powerful what you said, and I hate to repeat it, but I think it's just something I haven't had to think of, and so when you said that, it really stood out to me that you fought her whole childhood to teach her to be independent and be her own advocate,
Mhm,
and then all of a sudden the legal system requires you to take that back and
mhm.
be responsible for her and take her rights away. But I love how beautiful your family was able to find a way to reframe that so that you could all feel good about taking that responsibility with her, not against her. And thank you for sharing about Morgan. I know sharing her story can sometimes be hard, but I know she loves when she's the center of attention sometimes too. So
She
we're
certainly does.
so I think she probably appreciates us sharing some of her story with others.
So, Jill, can you share how advocacy has taken shape in your family story?
Yeah, I know for me, and we've talked about this before, I always thought medicine was black and white. Doctors knew what they were doing, and doctors are human. And I think the doctors who didn't include my opinion or my observations, it wasn't an opinion, it was just my observations of how Hallie was reacting, even at a young age, or doctors just looking at her diagnosis on a piece of paper
Mhm.
and not looking at her as a person. That was the first time I had to start advocating for her. I'm not confrontational until you mess with my kids and you get something wrong. And
Mhm.
then I become a mama bear, and I began to have to fight for her medical needs by making sure her doctors knew the full story.
Right.
And it was important that I model that behavior, in a positive way, but an assertive way, so that my children, even from a young age, would learn to become their own positive advocate for themselves and be assertive. And one thing you're asked every time your kid goes to the doctor is, "What are their allergies?"
Yep.
And so I remember always saying, "Hallie's allergic to blah, 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 blah." She had a lot of drug allergies. And so I remember she was 3, she barely spoke any words like mama, dada, Nini for Neely,
Mhm.
and she had to have surgery, but she had her little Hello Kitty on her lap, and the nurse goes, "Oh, what's your kitty's name?" And then she said, "Does your kitty have any allergies?" Because Hallie had just gotten her allergy ban. She goes, "Yes, Reglan, Zithromax, Phenergan, and Versed." And the nurse was like, "This kid can barely talk and knows these big words." And I think, and my eyes were like, "Oh my god, she said big words." And I realized how many times she's heard me tell her story to other people, that it was, like, really, like, a proud moment because I was like, "Wow, that's the first time she shared her story." She shared it through her kitty because she didn't know how to share for
Mhm.
herself. But I also realized in that moment that they didn't ask her what her drug allergies were, they asked me, and I automatically answered. And so when
Right.
she was 3 years old was the first time I started to slowly release those reins and let her tell her story, share her drug allergies if she chose to. So for me, I think that my kids' own experiences, we tried to fit in where advocacy fit with them. There was a time with B when they were little, hated hospital infusions because they were a hard stick. And it would
Yeah.
take a really good nurse, and we'd say we need the IV team. And God forbid we didn't have Nurse Leslie there who knew be enough to
Yep.
know you need a good stick to get this going. But when it was difficult and they were having tough times and we knew the needle had to go in regardless, I tried to give them some control of saying, do you want to do your needle now and then play video games, or do you want to do your needle now and then take a ride around
Mhm.
the infusion clinic on the IV pole?" Because it had allowed them to tell the nurse what they wanted and have control, but within the framework that we could offer them, because they had to have the needle regardless. So it was kind of a
Right.
forced choice, but it allowed them to be part of the process. And then when they get into the school and the IEP, that's a whole nother ball game, right? We
Yeah.
talked a little bit about them sharing, but including them in IEP meetings in middle school and high school.
Mm.
But I think one of my favorites, I guess Hallie was like her own feisty advocate, but Hallie heard over the years when I'd go speak to a class about good doctors and rough doctors, and she would go with me so she could be a part of the process. And I'd always share the story about the neurologist who said she had happy baby syndrome and didn't
Mhm.
believe that she'd amount to anything. And so when she was 7 years old, she did her first 5K, and it took her 52 minutes. We jog walked it, and we almost had to put her in the wagon, but she was like, "No, I'm gonna do it." And we did the little 5K outside the Campo YMCA. And at the end, the newspaper was there and they interviewed
Mhm.
Hallie. And she's like, "I have 18q deletion and I just did my first 5K."
Oh my gosh, that's so cute.
And he asked all about her. And at the end of the interview, um, she goes, "Is this going to be in the newspaper?" And he's like, "Yeah, it'll be in the Valrico section of the Tampa Tribune."
Mhm.
And so afterwards, Hallie goes, "Mom, when that article comes out, will you mail it to that neurologist who said all those bad things about me?"
Wow.
And I was like, "How about you mail it?" So when it came out,
Did
I
she
helped her cut it because
really?
her hands were had a hard time. And I addressed the envelope and I said, "You don't know us, but you told us this." And
Mhm.
Hallie signed her name underneath it. We mailed it. Never heard from him, but yeah.
Awesome.
Yeah, it was
That's
really
awesome.
cool. As we share these stories, I love me some storytelling.
Yep.
I do want to pause for a moment because our experiences aren't just shared to say, this is how you should do it. They're solely shared to say, you're not alone. So when we're talking to our listeners, this is what worked for my family, but I'm not saying you have to do it our way, but I just want you to know that you're not alone in this journey. We've been through it, we're still going through it, but we want to be there for you as well.
I agree. The truth is, every family's advocacy journey looks different. What worked for us in one situation didn't always work the next time. And
Absolutely.
what worked for Jill didn't necessarily work for our family, but we have shared a lot of strategies with each other over the years that helped
Yes, we have many sharing of our strategies. And sometimes a lot of your strategies you've worked with the twins have helped me with navigating Neely and vice
vice
versa.
versa. Yeah.
Yeah.
I was like, yeah. Many times I've called and been like, look, I'm going to lose my mind if something doesn't shift. And I'm like, what can I do?
You said I'm gonna lose my shit if I don't something doesn't shift. But yes, you did say that a few times. And now I think it's funny that I think it's almost serendipitous because many times what your kids are going through, mine are going through too. And it just
Right.
happens to be at the same time. And
Yeah.
it's like the universe knew I needed your friendship so that we could be there for each other through all the stages of our kids' lives and our lives.
Well, it helps
Uh,
that we just get it.
yeah, that's such a important concept that you don't need to explain yourself. We get it.
Yeah.
Uh, and now we want to just shift gears a bit to take a look at some of the tools that have helped us find our footing,
Mhm.
just to see if something helps you, great. If not, we would love to hear what works for our listeners when they're working on teaching advocacy
Yeah. They might
with
have
their
something
kids.
creative we haven't thought of.
I know, and we're gonna have a full list of strategies that worked for us, posted on our website and our show notes, but if you have anything, please share with us. I think talking to your child openly about their diagnosis from a very young age is so important and appropriate to their age and their capabilities because as they get older, we'll change that story up. But one of the things we did with Hallie is we always talked about her chromosome deletion and we talked about how chromosomes are like building blocks. And when she was little, we built up the blocks like the little square blocks, and we
Hmm.
have one missing in the middle. And I said, "You have a piece missing in the middle, but you're still make a pyramid. But what happens when you touch it lightly?" And she'd touch it lightly and it'd fall over. And I said, "Sometimes that's what happens." She goes, "Yeah, I fall over a lot." And so, and slowly we could talk more about those chromosomes as she matured to have a better understanding, but we talked to her in her language and what worked for her. Is there a strategy that comes to mind for you or one that we've talked about?
One of the big things is creating a health history. And I think, especially as they are transitioning from high school to college, having that health history because they don't always remember things from when they were younger or necessarily. But I think that was an important thing that we did before they went away.
Oh, that's a good one you bring up because I think of I'm a master storyteller, but I forget things, believe it or not, even before
Hmm.
menopause. And I remember it was New Year's Eve when they were 8 months old and they were wheezing so bad and making these grunting noises. And we were on the phone with All Children's nursing line. And she's like, "Is that the baby?" And we said, "Yes." And she said, "Call 911 right now." And the ambulance came and the paramedics said, "Yeah, they need to be seen." And John's like, "Do we want to transport in the ambulance? Because, even with insurance, it's going to be $1,200 because we've done
Right.
many ambulance rides." And the paramedic said, "If you feel like the baby's stable enough, but we'd feel safer." And we went back and forth. And I just said, "John, we're going to take the ambulance. It's a small baby. They're not doing
Yeah.
well." And as we got in the ambulance, I said, "Oh, yeah, they've coded before when they were 4 months old." And the paramedic's like, "They've coded on you at home before? That's an immediate ambulance ride in any future thing." I'm like, "I have 3 kids with medical issues. Hallie has a medical history." And he said, "Ma'am, it's okay, but maybe you need to have a print medical history for this child as well." And it was a hard moment because I realized B was gonna be as complicated.
Hmm.
But sometimes we don't remember or under emergencies, we may not remember all the right information, so having that health history is a form of storytelling when we can't get the words out emotionally sometimes.
Yeah. Another thing for me more recently, I found the journaling. I'm not creating a whole story on the page, but for me, because we have a lot of things that have happened, it's jotting things down and just making sure that I don't miss symptoms or experiences that she's had over the course of the last 6 months so that I can give a true picture of what's been going on.
Absolutely, and it doesn't have to always be a paper journal, like, I have a note section in my phone that we would do symptoms
Yeah.
when one of the kids was experiencing a new condition. I think that's a huge one, great idea.
Yeah.
I think one of the hardest ones for me in teaching my kids to be their own advocate was really stepping back and letting them take the reins and take the lead
Hmm.
themselves, especially when Neely went away to college. That was a tough one for me. And she made mistakes and just like I do in life, and we all do. But
Yeah.
for me, it was keeping my mouth shut.
And being like, I told you so.
Yeah, I couldn't do that.
Yeah.
I couldn't do that, and really just keeping my mouth shut and letting her make the mistake, even if it put her health a little bit at risk, and she got an infection and ended up at the ER. She's gotta learn how to navigate that on her own. I can't be
Yeah.
there to pick it up, so that was a hard one for me, but such an important one for me.
Well, I think too, we could go on and on and on for all different things that we've tried that definitely help create advocacy and becoming a better advocate. So definitely check out our show
Yes,
notes and we'll have some different suggestions. But I just want to say before we close, we want to offer a few general reflections, but not homework.
not homework, no.
Not homework.
Yes. So you might want to start asking yourself, where are opportunities I could allow my child to be their own advocate? Just start integrating it on a day to day basis. Or even asking, does my kiddo know their own medical history? We repeat it at the doctors, but do they know it themselves if I ask them that or if the doctors? Do they even know their medications, dosing, or their drug allergies? Even as soon as they get a phone, we started teaching them how to write down a section and they kept on, pinned on their
Mhm.
favorites of all their medicines and doses and allergies they had.
Well, I think for what I learned from you on a prior episode is that if you don't have the ability to do that, since Morgan can't do that, having a QR code that can be scanned
On a
to be
safety
able to
bracelet.
pull up all of her own stuff, I would consider that
Absolutely.
advocacy.
And that's giving her a voice through a physical thing. It
Hmm.
doesn't have to be her verbal voice, but you give her a emergency band with that QR code and you just opened a door to all her voice can say
Right.
about herself. I think that's a great example. And maybe start asking ourselves, do I let my kids answer the questions that the doctor's asking me? And I just wanted to also say for kids, if it's a young person with a disability or a diagnosis, start thinking about when you're communicating or making new friends, how much about my life situation do I need to share? Is it a safety issue? Is it something I need to share with my teacher or my coach? Do my friends need to know everything about me right now, or can it
Yeah.
wait a little bit? And I think if it's a healthcare provider, are you offering your patients, your pediatric patients, are you offering them chances to answer the questions? Do you direct the questions to them before you direct it to their caregivers? I think that's a big one.
Yeah.
And, helping them navigate their story, helping them say, if they ask questions about their diagnosis, give them real world examples of how to explain it to their friends.
Well, and I think all of those are great suggestions and very practical. So, as we close, your story belongs to you, it belongs to
Absolutely.
your child, and it belongs to your family.
You don't need the right words when we're storytelling. You don't need to give the full picture, and you don't need to share it all.
The storytelling is advocacy when it honors safety, consent, and truth, not performance.
Absolutely. And we appreciate you listening to us today. And we hope to hear from you about your storytelling. Next episode, we'll be talking about burnout as it relates to advocacy, because advocacy burnout isn't just being tired. It's what happens when you're being alert and prepared and ready to fight in that constant state of hypervigilance. That's where that exhaustion of advocacy comes in. So on that note, remember to be gentle with your story. Let it breathe, let it change as you change, as your child change, and most importantly, let it be your story. This is Strength Happens.